Hi everybody, thank you for hanging around. I hope all the people in this room are going to be mentors. I'm Dianne Orr. I'm a very proud, very passionate primary healthcare nurse. And I hope that I see I have seen a lot of passionate primary healthcare nurses. I'm here to talk about mentoring, and I think it's really important that we're going to have all these young graduates coming through, but what we need is mentors. So currently I'm part of APNA's Transition to Practice program. This is my second year. I work in correctional health, so I work in a prison situation in Victoria. So we're getting new nurses coming into that, transitioning into our primary healthcare centres. They need support. They need the support from someone who knows about your business, and I'm finding it fantastic. I've got my mentee from this year I'm in Victoria, she's in South Australia in the prison system here. So she needs somebody to help guide her through what we're going through. I've heard this morning about all sorts of different programs. So the Hep C treatment experts, they're experts and how they go around and communicate with everybody on site in primary healthcare. So hopefully I can inspire you a little bit. I don't want to get too involved in reading off there, and I don't want to get too involved in just giving you stats about mentoring, but I want to inspire you to become mentors. You're the professionals. You need to inspire all these people. Where's my clicker? Sorry. So I've got this little thing up here, and it's not necessarily about nursing, but it's from Bill Clinton, who was the President of the United States. People who grew up in difficult circumstances and yet are successful have one thing in common. At a crucial juncture in their adolescence or their life, they've had a positive relationship with a caring adult. And I sort of relate that back to us. They've had a positive relationship with a caring nurse in their career development. The value of mentoring. Mentoring provides the opportunity for experienced nurses to support the career development of newer nurses. Retention of staff with support and through development of relationships, increased job satisfaction, decreased bullying and horizontal violence, and therefore a healthier work environment, and goal setting and career guidance. A mentor is a guide, experienced and a role model who helps develop a new and less experienced mentee. In some circumstances, it can be a spontaneous relationship. So we've all got someone in our career that we can go and say, that person has inspired me, that person has helped me through my career. So I can inspire someone, but not necessarily be their inspiration. I can inspire you to look at people who will be your inspiration, and you can aspire to be a good nurse like they are, or relevant to that. A new primary healthcare nurse may be a sole clinician with no on-site support. So one of the things with APNA is we do have a lot of remote nurses. You might be in a medical centre and you're the only nurse there. So who do you go to when you want some inspiration, when you want some support, when you want some care, when you want some guidance? And this is why mentors are really important. So a mentee may be part of a team of seasoned clinicians, or they may be transitioning from an acute setting. So I was very interested that Kyle was talking about, it's just gone out of my head then, sorry. No, it's all right. Just forgot what I was going to say. So there's two types of mentoring that I want to talk about, and there is lots of different types. Mentoring's the sexy word at the moment, I believe. So everybody's got an input about what mentoring is. So we have an informal mentor, which we've probably had some conversations with someone we consider as a mentor. These types of mentoring happen by chance and maybe in social situations, at work, with colleagues, friends, strangers, at university or in other professional settings. What we're involved in with APNA is a formal type of mentoring. It has a structure, involves an agreement between the mentor and the mentee with a clear framework or guidelines, and often a program of support, education and evaluation. So the Transition to Practice program that APNA have been running has been very successful. They've got many more applicants to become mentees than they've got positions for. And I think I've just spoken with Hayley, and I think they're trying to look at expanding that, and it would be nice if we had a pool of mentees. a lot of people in this room have absolute expertise in their areas. What we need to do is to get you to share it. So whether it's in a local area, whether it's remotely, we just need to share it. Benefits for the mentee and the transitioning nurse. Personal development, I think support though is really important. Personal development, self-awareness, identity in the workplace, goal setting, dreams and aspirations, potential, knowledge, and making sure that it's a positive experience for them. Benefits to the mentor. Oh, I have a lovely pool of people to work with. I think that's wonderful. So we have vision and goal setting as mentors, and we work with our mentees about that. We inspire and motivate. So if you're a passionate nurse, you can inspire someone to be the same, and that gives us a succession plan. We lead by example. We've all been in situations, in placements and things over our years, and I've been a nurse for over 40 years, where you go and there was somebody there that you thought, I don't ever want to be like that person. Or there've been somebody there who's, I don't want students, so I hate looking after students, I hate looking after new people, I just want to get in there and do my job. They're not what we want to be. So we coach and we teach, and we get success, and we have confidence in our new employees and people. What does mentoring look like in a primary healthcare setting? Well, participants are matched through a process with APNA. As I said, remote nurses may be matched with a remote experienced mentor, and it gives you've got the same ideas and the same problems. So that's how they match those staff. Structured plan for program period and regular contact. So we have a contract. We have a contract where we say, yes, we're going to talk once a week. If I can't be at Melinda's site, I can ring her, I can FaceTime, I can Skype, all those things, email, and we find that really helpful. Well, I do. How many, just by chance, how many nurses in here are sole clinicians in your practice? Yeah. Have you got people you turn to? Yeah, it's good. Have you got people that you can mentor in those positions? I know your face is familiar, and yes, you've been doing it for many, many years. Okay, sorry. Initial meeting in the mentoring relationship. So I'm not trying to say I'm an elephant, but I probably, or that anybody else is an elephant. But I think that's really good. We're a balancing act, and we've got someone who's got experience and someone who's new. Getting to know each other. Where possible, it's ideal to meet face-to-face. We've talked about that. Be very clear about your expectations, your personal and professional goals, boundaries, any barriers, your education needs, and your contacts. We do understand our situations. We're matched by APNA in this program, and we understand the situations in our business. We have restrictions and uniqueness in our areas, so remote nurses, prison nurses, correctional health nurses, and it can make them feel less isolated as well. Best practices for a successful relationship between mentors and mentees: clear goals and program benefits, a strong support from management. So if you're on a site, you need to have your management and your team that are employing you supporting you. Mentors and mentees matched, which is really very helpful. Clear boundaries, regular meetings, contact. We've talked about all those things, how we do that. The evaluation of the program and the continuous improvement. I think that's really important, and I think APNA's collecting a lot of information about the transition to practice program, and I think they're seeing where we can improve on that. And on-site support for mentees from the workplace and colleagues. So really the mentees need to feel that they are supported in their practice. There's a few things that I've put down there. I think one of the things that a mentor must be is passionate about what they do. And we've all had people that aren't passionate. We need to be able to be an excellent communicator. I did have Lindsay Ty tell me once at one point that it's okay to be quiet. Silence isn't always a bad thing. You don't have to be talking all the time, and that really made me, I'm a bit of a talker, so that really made me think about that. It needs to be on a volunteer basis. No one likes to go to work and be told you're going to be this mentor. You're going to go, well, I don't want to be a mentor. Why would I want to be a mentor? I don't want. So you need to be volunteering. You need to be wanting to do it. You need to be open. You need to be a bit of a problem solver, not necessarily give the answer or give the solution, but be a problem solver. You need to be kind. I think that's one of the most important things. Be kind to people. We're nurses, we should be kind, and be approachable. So that's another thing that I think mentors really need to have as a quality. The mentee, a willingness to learn, enthusiastic, open, honest, proactive, How to make a mentoring plan. A statement of purpose is important. This would include why you're entering into the relationship and the general aims. You need to have some goals, and they'll be educational goals and goals of the joint relationship. The plan, how we will proceed with specific actions and anything that resources needed or assistance requested. A schedule, we need to discuss the frequency and forms of meetings and contacts. So that might be if you're going on site as a professional bowel screening nurse or someone, you need to have that discussion, well, I'll be there once a week or once a month or something. And the feedback includes completing learning, benefits and shortfalls of the program. So just a really good evaluation. This was just a bit of a thing I thought was really nice. It has it, before you start, agree where and how you'll meet. Mentoring is a supportive form of development that helps an individual manage their career and improve their skills. You need to be compassionate, inquisitive, positive, authentic. So there's a few things in there that we've talked about, which are just the qualities. Mentoring is a brain to pick, an ear to listen, and a push into the right direction. And I think that lots of skills in this room and lots of experience, and I hope lots of passion. And thank you.